My name is Adam Wells. I'm a clinical academic consultant neurosurgeon here at the Royal Adelaide Hospital and a senior lecturer at the University of Adelaide and the Abbie Simpson Clinical Fellow for the Neurosurgery Research Foundation. I've been reflecting recently on the journey to get to where we are now with our research. And the research is very well established here at the Royal Adelaide Hospital. A lot of clinical research is happening. A lot of students now partaking in full-time and part-time research activities. And that's really only developed the last 3 or 4 years or so. My own PhD started about 15 years back. I first started my neurosurgical training in the year 2008. 2010 is when I started my PhD studies, and that journey led to me becoming a consultant neurosurgeon, going overseas, then returning to Australia 2018, and that also coincided with the establishment of the Abbie Simpson Clinical Fellowship for me. So it was a 10-year journey from starting my neurosurgical training up until becoming a clinical consultant, academic consultant, and the NRF Clinical Fellow. 10 years, and it's gone by in the blink of an eye, but we've achieved so much. So from 2008 to 2018, start of training to establishment of consultancy in the Abbie Simpson Clinical Fellowship. Then the last 6 years, we've grown from having basically no students to having 4 high degree research students, about to add another one, and another half a dozen medical students. So over 10 students doing research in clinical neurosurgical research, and that's absolutely fantastic. So the Trevor Denning Scholarship is now supporting travel for junior doctors travelling overseas to learn skills to bring back to Australia. And that should be encouraged and fully supported, and we'll get more and more skills back here in South Australia from overseas. And without the support from the NRF, it would have been prohibitively expensive and might have even jeopardised the whole thing. A lot of the supervised research we're doing at the moment now revolves around traumatic brain injury, which is excellent because we have a high volume of traumatic brain injury here at the Royal Adelaide Hospital. We've got a lot of interest in some subspecialties as well, including the trauma service and the intensive care specialists. And you've probably heard of the work we're doing in ROTEM, in TBI. So ROTEM is the Advanced Coagulation Profile Assessments, which we're comparing versus standardised or traditional coagulation assessments. The ROTEM is a point of care test and is more of a live action test of blood clotting parameters, and should reflect much better about real life blood clotting in the patient than the standard traditional tests have proven to be. You can imagine that inside someone's skull, if they had a brain injury, if they had a blood clot which gets bigger and bigger and bigger, that's going to destroy more and more brain and cause lots and lots of other problems. So we're trying to demonstrate that if we can, first of all, assess the suitability of checking ROTEM in this patient population, and then secondarily, if we can improve coagulation parameters based on what we find on the ROTEM testing, that we can improve patient outcomes. Look, I think what next is, I'd really like to push for some Royal Adelaide-based randomised controlled clinical trials, particularly in TBI, particularly in chronic subdural hematoma. I think the data that we're accumulating now for ROTEM in TBI and ROTEM in chronic subdurals in particular is going to be very exciting. And I'd really like to push for some level 1 funding from MRFF or NHMRC with the NRF seed funding, and I think we're going to achieve that. I think we've got enough data so far, enough positive results so far, that we've got a really good shot at getting some high-level funding to do some really important multi-centre clinical trials. A lot of the work that we're doing now, it should improve patient outcome. A lot of the work we're doing now on coagulation testing in brain injury and chronic subdural hematoma, we're hoping it's going to lower reoperation rates. We're hoping it's going to reduce the rate of expansion of hematoma inside someone's brain after a traumatic brain injury. We're hoping that it's going to lead to less surgery, safer surgery, and lower inpatient hospital stays. And we're also hoping that this technology is going to be picked up by other centres around Australia and even the world. And something so simple as a better correction of coagulation in someone who's had a brain injury might have really profound ongoing effects and improve clinical outcomes, not just here in South Australia, but everywhere. It's a fairly simple test, it's underutilised, and if we can show that it's effective, I think it's going to have really long-lasting and wide impacts around the world.